Here are the top 10 products you need if you are a prenatal chiropractor. My name is Dr. Cassidy. I am from CHIRO for Moms and CHIRO for Kids, which is a specialty clinic that has been built for busy moms and their children. We specifically cater to moms that are pregnant and in their postpartum journey. So you're in the right spot. You came to the experts, and we are going to share with you the 10 things that we could not make it through the day without. Number one, by far, is our Bellow pregnancy pillow. We love our pregnancy pillow, and our pregnant patients love our pregnancy pillow. It is unmatched from any other pregnancy chiropractic pillow I have seen on the market. Let me tell you why. There isn't just room for belly growth. There's also a cutout for the breast tissue, because women don't just grow the belly, their breast tissue also grows, and it causes posture changes in their thoracic spine. So being able to have that cut out in order to have their spine laying flat for treatment is incredible. And your pregnant patients love it because they finally get to lay flat for the first time. A lot of chiropractors will choose just to use a breakaway abdominal section. We find that the pregnancy pillow with the abdominal breakaway is the great mixture because it's more comfortable for the patient. And then as they grow, you can utilize that breakaway piece, especially when we're talking third trimester care. As we are going through these 10 products, you're going to realize one thing: we love pillows. Pillows are incredible. You just have to know which pillows to use. That brings me to number 2, our second pillow, a knee wedge. May seem shocking, we use this for all of our pregnant patients when we want them in a supine position, but we don't want them laying flat, which in our space, we just never have pregnant women laying flat, but especially once they hit that second trimester, that's when we're gonna see some effects of abdominal vessel compression. So we wedge them using a wedge pillow and product number 3, a bolster. So we use a bolster for everyone in side posture. It provides a space to rest the head and neck without us constantly adjusting our headpiece. So more comfortable for patient, less of a annoying task for the doctors. And then we're also using it with the knee wedge to set up our pregnant patients in a supine position. This is not one of our 10 products on the list. This is going to be the bonus product. We use car seat covers to cover our knee wedges. They're washable, so we can wash them and keep them clean frequently, and they're really pretty, so you can find a print that fits the vibe of your clinic. Plus, they don't make pillowcases for knee wedges, so that's how we solved that problem. Product number 4 is extra pillows for pregnant patient positioning, specifically positioning your patients properly in side posture for adjusting. We use these lovely little guys. They are just basic pillow inserts that we found leather covers for, so they are wipeable. Genius. With chiropractic care during pregnancy and postpartum, there is a lot of soft tissue work that needs to be done in order to get great results for our patients. That can be a little taxing on your most important piece of equipment, which is your hands. So save your hands and find a massage tool that works for you, which brings me to product number 5, our hot stones. We use hot stones to warm up our patient's body before we even start adjusting, and it feels incredible for them, but you don't have to necessarily do that. There's other massage tools you can use. Just pick something that you will choose to use over your hands, because your hands are your most important piece of equipment, and you can't get hand fatigue, you can't be dealing with thumb injuries, wrist injuries, you name it. Save these lovely hands for adjusting and use a massage tool like these hot stones for all your soft tissue work. Number 6, the Activator. Now, we at CHIRO for Moms mostly do manual adjusting with our hands on our pregnant and postpartum patients, but we still have every room with this tool. Let me tell you why. When a patient comes into us, one, for the first time, there can be a few hesitations with adjusting, especially with the neck adjustments, but neck adjustments are very important in a lot of different pregnancy and postpartum pain complaints. So enter the Activator. We don't have to instill motion. We can get that mobility using a tool rather than our hands, and the patient is more comfortable. When your patient's more comfortable, they're going to get better results. We always try to meet the patient where they're at. If they use an activator on that cervical spine in their first 5-6 appointments, who knows? Maybe someday they will try a manual cervical adjustment and really enjoy it. But we meet them where they're at. We can still get great work done using an activator tool. It's also really great for specific sticky spots, especially in the CT junction. And I also love using it on trigger points. Product number 7 is really going to throw you for a loop, but I could not put it on the list because it's the tool that I would always rather be looking at than looking for. So I'm not using it in every single treatment with a pregnant patient, but when I need it, I am so happy that I have it. Product number 7 is a scarf. If you treat during pregnancy, you know where I'm going with this. Scarves are one of the tools you can use, Rebozo or just a cheap version like so, to do belly sifting and glute sifting. 2 techniques that we use all the time during pregnancy, especially for breech presentations, but when we are talking belly sifting, it's also really helpful for pain complaints like low back pain, pelvic pain, and rod ligament pain. If you don't know how to do belly or glute sifting, you should check out this video. Our last 3 products are all related to patient education and being able to demonstrate even just the simplest basic of exercises and stretches for your pregnant and postpartum patients when they're in your clinic, so then they have tools at home when they're not in your clinic. They can help alleviate their pain with the tools you give them and show them in your office. So number 1 is an exercise ball. If you watch our stuff, you know this was gonna be on the list. Every single patient should have an exercise ball. Every single one. Period. That is blanket statement. Yes. Exercise ball for mobility, exercise ball for pain, exercise ball for labor and delivery prep, exercise ball for stretches. You name it, it will be one of your most useful tools. Yes, it takes up a lot of space, but once you get a pregnant patient in your office sitting on an exercise ball, they're gonna understand why they need one at home. The next tool you're gonna want is a lacrosse ball or a tennis ball. So then you can demonstrate some muscle release techniques for your patients. We use it most frequently on the mid-back and the glutes. The final product we're going to talk about that you need if you are treating pregnant patients is an extra pregnancy belt, mostly for demonstration purposes because pregnant women typically don't wear the sacroiliac joint belts correctly for the pain they are feeling. They usually put it up way too high and treat it like a belly band. So whenever we are recommending pregnant belts to a patient, we are demonstrating how they should put it on, how tight it should be, when they should be wearing it, and how. It's really important because if the belt is positioned correctly, the relief should be almost immediate. They will see the benefit of getting their own, and in emergent situations, you can give a patient your extra belt when they are waiting for theirs to arrive at their front door. And that's a wrap on our top 10 products for clinicians who treat during pregnancy. If you are curious on the other products we use and recommend, go check out our full shopping list, Extras for Doctors. And of course, subscribe so you stay in touch with all of our business tips, tricks, solutions, products, you name it. And if you can't find what you're looking for, shoot us a message.